Ken Karain. It doesn't have an address on here. I assume you're from Missouri? Okay, great. Welcome. We're glad you're here. You have 2 on here.
I would like to know who Dr. Emanuel is.
I'll be happy. Well, I don't know him. He's, you know, I will tell you, I made I think an appropriate joke about this yesterday. He is Rom Emanuel's brother, and he is a doctor, and I'm not going to speak for Dr. Emanuel or Rom Emanuel. I will just tell you this. I've got a brother, and trust me, we don't agree on much.
One of the things older people and younger people with disabilities have no value.
Yep. I want to talk about that. I want to talk about that. And my mother, sir, that would be 3.
Second question. What is HR 615?
I think that's the House bill that talks about us using the same insurance as that we would write.
The same insurance
Yeah.
that you are giving us, you would use.
Right. That's what I just talked about before, and I said I would do that.
No Democrat has signed it.
Well,
There are 65 Republicans.
well, I'm not in the House, so it would be weird if I did it. But let's talk about that for a minute. The question is that there has been information put out there that somehow somebody in Congress thinks it would be a good idea to dictate to elderly people or to infirm people what kind of health care they could get. And let me tell you what is actually being proposed in some of the bills. And I feel my mom staring at me right now. There were 2 hospitals, and I think maybe most of you have heard of the Mayo Clinic. And the Mayo Clinic decided to do things differently than the University of California and Southern California. And they studied the 6 months at the end of life for a large group of patients at both hospitals. At the Mayo Clinic, it was about the patient. It wasn't about what test would be reimbursed, what surgery would be reimbursed, or what procedure would be reimbursed. It was around the patient. They made sure the patient and the patient's family got all the information, that the doctors took the time to explain every surgery, what the recovery would be, what the quality of life might be afterwards, what kind of longevity it might give them to their life. And every single one of them got information about hospice and the advantages and disadvantages of hospice. And they found that the Mayo Clinic group had a better quality of life. They reported, they asked them on a monthly basis, weekly basis, how do you feel about the care you're getting? How do you feel about what you're able to do? And they were very, very satisfied. Not so much at the University of Southern California. Not so much. They felt like they weren't being told things. They felt like decisions were being made for them. They felt often the decisions were being made by their insurance company or the doctors without really listening to them. And guess which was half as expensive? The Mayo Clinic. All this bill says, all the provisions in the bill will do is reimburse doctors for their time to sit down and visit with patients and their families about the consequences of the choices they're making. That's all it does. All it does. And how many people in this hall have family members that have done hospice? Okay, I think I've talked to a whole lot of people whose families have done hospice, and they said what a godsend it was to have their loved one in their home and with the kind of care they needed that was loving. And all the bill does is make sure that you get information. It doesn't require anybody to take hospice. It doesn't require anybody to not get surgeries. It simply does not. All it does is reimburse for the time that the system would take to make sure the patient can make informed decisions, and it keeps the patient firmly in control. And I want to tell you, I don't want to be part of an America that doesn't have that as a priority. And I think most of you probably agree with that. So, and by the way, and let me put on my cynical hat for a minute. If you don't trust me because you think what I'm saying is not accurate, then let me me just say this. Part of the problem in Washington, one of the reasons we keep kicking this can down the road in terms of looking at healthcare costs and insurance reform, one of the reasons we kick things down the road is because it's hard because people get upset and people in Washington want to keep their jobs. So they hunker down and they try to do whatever they can not to offend anybody. Okay? And we just kick problems down the road. We have the same problem with the deficit, we got the same problem with Social Security, we got the same problem with healthcare. Now, one of the groups that is the most important to anybody to get elected, anybody, the most reliable